The frequency in which these side effects occur varies based on the immunotherapy or whether it is a combination of two immunotherapies. So as expected, with one immunotherapy drug, the frequency is a little bit lower than when we start combining immunotherapies. So with one immunotherapy, side effects can happen in up to 50% of patients or so, but the majority of those will be lower in intensity. So often things like a mild rash, some fatigue that's very tolerable to the patient, but they notice something's different. And sometimes we can treat those, if it's a rash, for instance, we can treat with a topical steroid, and we don't have to necessarily even hold the therapy. So we have a grading system in which we grade the toxicities or the side effects on a scale of 1 to 4, 4 being the most severe, and 5 actually if it's death that results from the side effect, which is very rare but can happen actually. So really our treatment and our approach into whether we have to hold therapy or whether we have to administer topical steroids or oral steroids or other advanced drugs that block the immune system depends on the grading of the toxicity. So for many grade 1 toxicities, we can continue with treatment and actually just support the patient however is needed. And for once you start getting into the grade 2 that's very persistent, or the grade 3 or grade 4, certainly we would hold the therapies and administer things like steroids or other agents to block the immune response to reverse those side effects. And so that's the same really for the monotherapy versus the combination. It's just that with the combination we're even more vigilant and even more quick to react, because those side effects can happen both higher in frequency and earlier in the course of the treatment.